Welcome back to the Medical Weight Loss Show. I'm your host, Dr. Andrea Walker, family nurse practitioner, DNP, weight loss specialist, and IFBB Pro. Today's episode is one I've been getting a lot of questions about: the new Wegovy Pill. You may have heard that Wegovy is now available as an oral medication, and many people are asking, does it work at all? Is it safer or easier? And then some who are familiar with the compounding version are wanting to know, does it compare to compounded semaglutide or tirzepatide? So today we're going to break this down. We'll break it down clearly, honestly, and from a medical provider's perspective. I've owned a weight loss clinic since 2017, and I started prescribing and promoting one of the first weight loss GLP-1s, liraglutide, back in 2019. And I've been prescribing GLP-1s, GLP-1/GIP since then. So I'm going to provide you with the information I know so you can make informed decisions about your health. So let's start with the new Wegovy Pill. We'll start with the basics. The Wegovy Pill is an FDA-approved oral form of semaglutide, the same active ingredient used in injectable Wegovy. This is the first oral GLP-1 medication approved specifically for chronic weight management, not diabetes, but weight loss. Will patients who have diabetes be prescribed it? Sure. That's just a fact. But just like the injection, it works by reducing appetite, increasing fullness, slowing stomach emptying so that you stay fuller for longer, and then it helps regulate blood sugar. The difference is how it's taken as well as the doses. Instead of a once weekly injection, the pill is taken daily on an empty stomach with water, and you must wait before eating or taking other medications. So let's start with the actual doses, and this is the oral form. And keep in mind, this is the brand, the new Wegovy Pill. It comes in a 1.5 milligram tablet, a 4 milligram tablet, a 9 milligram tablet, and a 25 milligram tablet. You want to start with the 1.5 milligram tablet every morning for 30 days, then increase to 4 milligrams every morning for 30 days, then 9 milligrams every morning for 30 days, and max out on 25 milligrams every morning. And you would stay there until your provider decided to start to wean you off or lower the dose. And just like with the injections, not everyone will need to increase their dose every single month, and not everyone will need to max out on the highest dose. But those are the recommendations. And just for comparison's sake, I'll go over the injections and the dosing. The Wegovy injection starts at a 0.25 milligram. Then you can increase to a 0.5. Then from there, 1 milligram. After that, 1.7 milligram. And right now, max out at a 2.4 milligram. There has been research on increasing the injections to even higher, but we'll save that for another episode. So let's talk about why the difference in the dosing, the oral versus injections. This is important. Oral medications have to survive digestion and absorption through the gut. The dose of oral semaglutide is higher than injectable semaglutide. For example, as I just said, injectable Wegovy tops out at 2.4 milligrams once weekly, but the oral Wegovy reaches 25 milligrams, and that's daily. That doesn't mean that it's stronger. It means less of the medication makes it into your bloodstream when taken orally. Different route, different dosing, same hormone. So, do the pills work as well as the shots? I would say that's to be determined, but here's what we know. Clinical trials show that the Wegovy pill produces very similar weight loss results to injectable Wegovy. In large studies, patients lost an average of 15 to 16% of their body weight, which is comparable to injectable semaglutide trials. The side effects were also similar: nausea, vomiting, diarrhea, and constipation. So, from an effectiveness standpoint, yes, when taken correctly, the pill can be just as effective as injections per research. Now, here's why, of course, some patients are going to want to take the pill over the injections. And these are real world considerations. Some patients prefer pills because they don't have to deal with the needles, they don't have to inject themselves, and the oral version does not require refrigeration. But others actually do better with injections because it is once a week. They don't have to remember to take it daily. And then there's no strict timing with food or other medications. And the injections have better adherence for some people. I want to put this out there. There are several legit 503A compounding pharmacies who have been compounding semaglutide as well as tirzepatide in the oral form. And they were doing this before January of 2026. So I want to tell you about the compounded versions of these medicines. So they are not FDA approved. They do not have large scale clinical trials, and they can vary in potency, formulation, and purity. If you are going to use the compounded version, I highly recommend you go through a 503A compounding pharmacy, and your provider would know this. However, the dosing right now, as of January 30th, 2026, most of the compounding pharmacies are only providing 2 doses of their version of compounded tirzepatide. For legal reasons, they cannot call it the Wegovy pill. I want to just tell you about the doses from most of the compounding pharmacies for semaglutide. And they are generally a 5 milligram tablet and a 10 milligram tablet. And that is it. I've seen many patients take the oral version of the compounded semaglutide. And I will be honest, I'm telling you what I know. It works for some. However, many, more than not, will eventually switch over to the injections. I have seen patients do really, really well on the oral version, and these are patients with various BMIs. I've seen patients with BMIs in the 40s. I've seen patients with BMIs in the 30s, as well as BMIs in the 20s. And just to give you a little bit of background information on BMIs, the higher your BMI, that means you weigh more for your height. Lower BMIs, you weigh less for your height. Personally, if a patient comes in and they ask me, do I recommend oral versus injections? Hands down, I'm going to tell them injections. But if a patient is terrified of needles, they just really want to take the oral version, I will say, okay, sure. I lay out what I know and I lay out the facts. And I tell them the difference. I let them know facts versus my thoughts and let them make a decision from there. So I just wanted to put that out there. And this is really for both providers as well as consumers. Many are going to telehealth companies, and the majority of telehealth companies right now are using the compounded version. I am not knocking that at all. But just know that the compounded versions, the dosing right now is completely different than the new Wegovy pill. Like I said, compounded version of semaglutide generally maxes out at a 10 milligram, whereas with the new Wegovy, you can go up to 25 milligrams, and there's several doses, whereas with compounding, there's only the 2 doses. Now, I imagine things will change over time. There's a lot of legalities in it, a lot of FDA regulations. So, a lot of times the compounding pharmacies are, quote, walking on eggshells in order to even offer it. But just know that you will hear patients say, "Oh, I've been taking this for years. I've been taking the oral version." What they are talking about, if they're not talking about Rybelsus, which is something else, it's semaglutide, but that is more so for diabetes or diabetic patients. But if they are saying they've been taking oral compounded semaglutide for years, then that is what they are talking about. So I just wanted to clarify because a lot of people are asking about it. People are calling and they're saying, "I want to start the new Wegovy pill. Do you have it?" And so just know that you're going to hear various doses. But to clarify, Novo Nordisk is the only one that makes the branded FDA Wegovy pill that providers have started to prescribe over the past couple of weeks. Now, if you ask my opinion, what do I think about compounded version? If you've listened to any of my podcasts, you already know that I am a proponent of it. I don't have a problem with it. Like I said, I've had a clinic since 2017, and I've been using compounding pharmacies with no problems whatsoever. I love them. I don't have a problem prescribing brand either, and it's always the patient's choice. I lay out the facts, and we go from there. And speaking of facts, why FDA approval matters. This is something I want patients to understand. FDA approval simply means the medication was studied in thousands of people. The dosing is standardized, so you're not going to get customized dosing like you would with compounded version. And then the side effects and risk are known because studies have been completed, as well as the manufacturing is regulated for safety and quality. Now, have I personally had a problem with any of my patients taking the compounded version? Absolutely not. Now, let's move on. So, who is a good candidate for the Wegovy pill? The Wegovy pill may be a good option if, of course, you meet criteria for medical weight loss, you prefer oral medication, you can reliably take it daily as instructed, and you are working with a provider who monitors your labs if needed, nutrition, side effects, and encourages you and promotes you on your weight loss journey. It's not a shortcut and it's not magic. GLP-1 medications work best when combined with proper nutrition, adequate protein, strength training, and lifestyle changes. Now, if you're considering weight loss medications, whether injections or oral options, it's important to do this the right way. If you have questions about the Wegovy pill, injections, or which option is right for you, make sure you reach out to a licensed healthcare provider because weight loss isn't just about the scale, it's about long-term health. And as a disclaimer, although I am a licensed family nurse practitioner, I am not your doctor. So please always consult a licensed healthcare provider, meaning a medical doctor, a nurse practitioner, or a physician assistant before making any changes to your health. I hope you enjoyed today's podcast. Thank you for tuning in. Please like, share, and make sure to subscribe so that you can follow us for every podcast episode. Don't forget to meal prep, work out, and make sure you drink your water. Until next week, I'll see you later. Bye for now.